October 10th was World Mental Health Day, a day to raise awareness and a chance to talk about what more needs to be done to make mental health care a reality. Calissa Ngozi, mental health professional, joins me now in studio. Thank you so much for joining us today.
Oh, thank you for having me.
Well, let's just get right to it. Mental health, and specifically kids' mental health these days, is a major priority for so many communities and for parents. What are some tips you can give us right off the top in even bringing up the conversation with kids?
Well, I think at first we need to acknowledge it. I think a lot of people don't want to acknowledge what mental health is, what it looks like. And I find a lot of times parents don't know what are the signs and symptoms if my child is going through some sort of mental health crisis. So I think the first thing is just when we acknowledge it, talk about it. Like, what is mental health? What does it mean to you? You can also look at heredity speaking. Does it follow in a past with family, with friends? What is that connection piece that maybe is missing with kids? And if your kids are acting differently, then that is a sign maybe they aren't okay. And I think if more parents recognize that and then look for help, then it makes it easier.
And sometimes I think as a parent, you look at their behavior and think, maybe this is just a behavioral thing, and aren't quite sure where to go from there. What do you say to parents who say that?
Well, look at it for what it is. Is this puberty? Are they going through a different life cycle? Or is there an actual tangible problem that we need to take like the bull by the horns, as they say? And I think if your kid is acting differently, if they're more aggressive, if they're more recluse, any sort of sign or symptom that is abnormal for their typical behavior is when you need to start to look and say, maybe there's an issue that I need to talk to my doctor about.
And how about the parents? And how about adults? Sometimes acknowledging mental health for adults is very difficult. It's not something that was readily talked about years ago.
There's a huge stigma around mental health, and we're in 2024. So yes, we're trying to shatter it, but we need to do more. I mean, it's great that we celebrated, World Mental Health Day last week, but every day, 365 days a year, we need to be celebrating that mental health is something that affects absolutely everyone that you're connected to. So whether it's yourself, whether it's family, friends, your kids, and I think that if your kids are going through it, then the parents are going through it. And you need to label it. And I know that it's harmful, it's hurtful, but if we don't acknowledge what's happening, then we can't fix it, right? So I think offering support to the parents is crucial.
Absolutely. And another hot topic for so many parents and teachers and communities is social media. And how to manage that with our children. So
yes.
Do you have any advice for that?
Yeah, you know what? When you and I were in school, there was not social media.
Thank goodness.
Like, I didn't have somebody with a cell phone in my face, like recording stupid things that I've done, right? So it is the amount of pressure that we have on these kids because of social media is deafening. We are in the anxious generation. Our kids are not okay. And social media is a huge proponent of that because we've got bullying, we've got cyberbullying, emotionally speaking, our kids aren't maturing like they should be. And it's, I want to be like my friend Billy or Tanya, and, giving kids cell phones earlier as well, so they have earlier access to social media. Even games like Fortnite and Roblox, we've got Kids Messenger, all of these pieces, these kids aren't playing outside anymore. They've lost the ability to be children without the effects of media.
And how important is it as a parent to teach our children how to use, say, Kids Messenger and how to communicate with that? Because I'm finding even with my own son, he doesn't know how to do that. And that's a skill that I think we take for granted as adults, but we have to teach our kids this.
Yeah, absolutely. Our kids are not us. It's a different generation now. So they're needing to learn earlier these skills, right? They're soft skills and proper communication. Who do we talk to? Who do we become friends with? Does anybody on the internet have access to me? So as parents, it's really important to make sure that we're safeguarding our internet at home, that they don't have access to content that is not age appropriate. But also, if they do come across this content, we're giving them the skills and tools to be able to come to us and say, Mom, I don't think that this is okay. Can you help me navigate it?
And what about the conversation that so many of us are having with our kids? Maybe the argument over, Mom, you can't look at my phone. You can't look at my conversations.
Yeah.
but we have to monitor them.
Yeah, until you move out of my house, that's my phone. So I'm gonna monitor it, right? So it is for their safety. And I think at the beginning, having those conversations with your kids, listen, mommy or daddy is gonna buy you a cell phone, or you can use your money to buy the cell phone, but let's make it clear, until you're an adult, I want the passcodes, I want all the passwords, I want all of it. And it's not because I'm trying to invade your privacy, because that is important. They do need to have some privacy, but you're monitoring to make sure that the people they're talking to are safe and kind and aren't leading them astray to do things that aren't productive.
Amazing advice. And what about in terms of resources? Because it can be very difficult and daunting to know where to start.
Well, and I think in Canada, yes, our healthcare is free, but the wait lists are astronomical. To access mental health services, I know we don't like the word wait lists, but there are wait lists everywhere. And what's happening is we're having parents that are trying to access these services when they're in a crisis situation, and all they want to do is have help for their son or their daughter, but they can't get it right away more often than not. What's great is that we do have Contact Niagara, we have Passstone Mental Health, so we have these resources in Niagara that parents can start and have those conversations. Obviously, if it's a huge crisis situation, you're going to take your child to the hospital to get assessed, hopefully by a psychiatrist that is well-versed in kids. But it's hard, it's so tough. I think continuing to share these resources, having it available, and also on a government level, recognizing there's an issue and you need to put more funding involved for these kids.
Well, as much as I'd love to go on for another hour, that's our time. Thank you so much for joining us in studio. We'd love to have you back.